Leg length discrepancy is one of the most underrated factors when it comes to lower back pain, gait disturbances, and persistent muscular compensations. Many patients live with small differences in leg length without even knowing it. And you, as a professional, might be overlooking a key detail to understanding their pain. Even differences as small as 5 millimeters can cause enough muscular adaptations to trigger overload in the pelvic muscles, changes in lumbopelvic mechanics, fatigue and compensations in gait, reduced performance, and chronic lower back pain. And what's most interesting is that not all muscles respond the same way to a leg length discrepancy. In this post, you will learn what specifically happens in the gluteus medius and the spinal erector, based on an analysis using surface electromyography. By the way, if you identify with any of these statements, such as wanting to make more objective diagnoses, adjust exercises with greater precision, improve patient adherence, and achieve better results in less time, then contact us and we'll show you how to integrate EMG into your sessions without adding extra time. Now, let's get to the topic. How does a leg length discrepancy alter the mechanics of the pelvis and spine? An imbalance in leg length produces immediate mechanical changes because when one leg is shorter, the pelvis drops toward the short side, which we call pelvic obliquity, and the lumbar spine compensates with a lateral flexion toward that same side. This alters the distribution of loads during walking and sports movements and increases the stress on the ligaments, fascia, and lumbar muscles. A severe leg length discrepancy is not necessary to change muscle activation. Even with as little as 5 millimeters, adaptations already appear. Furthermore, there are two types of leg length discrepancy, and that's why they affect the muscles differently. The structural or true type is a bony difference in tibial or femoral length, and it causes permanent changes in motor patterns. And the functional type, caused by postural or muscular asymmetries, which can be corrected with neuromuscular treatment. Both can alter the activation of two key muscles for pelvic and lumbar stability, the gluteus medius and the erector spinae. But they don't do so in the same way. And this is where the data matters. What does electromyography show during walking and jumping with simulated leg length discrepancy? In this study, a group of healthy subjects performed walking at 5.7 kilometers per hour and counter movement jumps, or sEMG, with artificial leg length discrepancies using insoles of 0.5 centimeters, 1 centimeter, and 1.5 centimeters. And this allowed for precise observation of how the muscles react to changes in leg length. First, what happens with the gluteus medius? The response was clear and consistent. The greater the discrepancy, the greater the activation of the gluteus medius on the shorter side. This muscle tries to correct pelvic drop and maintain stability in the frontal plane. And this leads to increased muscular work, more effort during the support phase, premature fatigue, and a higher risk of lumbopelvic overload. Clinical interpretation: a gluteus medius that is overworked will eventually fail. And when the gluteus medius fails, the lumbar region pays the price. Second, what happens with the spinal erector? Here comes the most interesting part. The spinal erector did not change its activation in response to the discrepancy. This means that the lumbar muscles do not compensate for that imbalance, and the pelvis can become unstable if the gluteus medius fails. Clinical conclusion: the spinal erector does not adapt and the lumbar region suffers. A combination that very clearly explains idiopathic low back pain in patients with mild leg length discrepancy. And third, does it affect performance? Yes, and more than you think. Because subjects who used insoles of just 5 millimeters already showed worse performance in jumping, less ability to produce force, and poorer landing control. Muscular asymmetry affects not only pain, but also overall mechanical efficiency. So even mild leg length discrepancy can mean worse performance and a higher risk of injury. With all this, the clinical implications are clear. The gluteus medius is extremely sensitive to changes in leg length. Altered activation of this muscle can be related to lower back pain, especially in patients who walk, run, or jump with repetitive patterns. And even 5 millimeters can change the motor pattern. And this is where EMG makes a difference, because it allows you to see the actual activation of each muscle, compare the healthy side to the affected side, adjust treatment precisely, and know when an orthotic helps or harms. If you want to learn how to assess these synergies and create precise treatments, EMG lets you measure what the eye can't see: compensations, deficits, overloads, and altered motor patterns. And if what you're looking for is to make more objective diagnoses, fine-tune your exercises, improve patient adherence, and achieve better results in less time, talk to us, and we'll show you how to integrate EMG into your clinical practice. See you in the next post.